Hello.
Good morning, Anand sir.
Good morning, everyone. Thank you.
Hi, Andy. Morning.
Hi.
Very good morning, Kiran ma'am.
Good morning. I hope I'm in time.
Yeah, ma'am. Sure. Thank you. Thanks a lot for joining me.
Morning, Dr. Kiran.
Hi.
Morning, all of you.
Gaurav, I think now everybody is here. We should start. And Dr. Chaya has a small video. Whenever we are ready, we can just ask her to play it. Over to you.
Sure. Thank you. Thank you. Thanks for the update, sir. So over to you, section. We can start now. We have all our guests and panelists.
Yeah, hi. Good morning, everyone. Welcome to the Global Bio India Roadshow and the third edition of the Catalyst Thought Leadership Series, which has been created with a purpose to have discussions on all subjects that are relevant in the current context of the human society and environment. This roadshow is a part of the Global Bio India 2024 Biosciences to Bioeconomy, happening from 12th to 14th September at Pragati Maidan, Delhi. It is going to be a mega international congregation of biotechnology stakeholders. This annual event is organized by the BIRAC, a public sector undertaking under the Department of Biotechnology, Ministry of Science and Technology, Government of India, showcasing India's biotech growth and opportunities to the world. Now, giving a little bit context of IIT Mandi Catalyst, it's a TBI launched in 2016 with a strong vision and mission. We have supported approximately 500 startups in various capacities till date. Now, I would like to introduce our panelists for today's topic, current challenges startups face in the preventive healthcare ecosystem. So first, we would like to welcome Dr. Shaya Chauhan, leading the BioNest and EUR programs of BioRac, under which 75 specialized biotechnology incubation centers have been established across the city. Also responsible for handling national and international partnerships and a part of BioRac's communication team. She is here as a BioRac representative and a panelist. Then we have Dr. Kiran Jakar as a panelist. She's a psychiatrist at JIMS, Noida, MD, DNB psychiatry. Her work is in the fields of brain mapping and recent advances in the field of psychiatry in terms of neuromodulation techniques. Then we have Dr. Vikrant Kaur as a panelist. He's a faculty, hospital administration, and deputy medical superintendent at AIMS Bilaspur. Dr. Vikrant has been transforming healthcare through digital innovation and telehealth solutions across India for over 20 years. He's an esteemed mentor at IIT Mandi Catalyst and mentored a lot of startups to fruition. Then we have finally Dr. Anand as our moderator and as a panelist. He's head SRIIC Srihar. Dr. Anand is a seasonal professional with extensive experience in strategic leadership and innovation. His expertise spans across various industries, including technology and business development. Anand is known for his analytical mindset, problem solving skills, and ability to foster a strong team dynamics. Now, I would like to invite Saurabh, our senior advisor here at IIT Mandi Catalyst, to throw some light on a vision and a mission of IIT Mandi Catalyst. Good morning, Saurabh.
I thank you, sir. Am I audible?
Yeah. Yes, sir, you're audible.
Okay, great. First of all, a warm welcome to Dr. Chaya, Dr. Vikrant, Dr. Kiran, and Anand. Thank you for agreeing to do this panel discussion as part of Thought Leadership series that we had launched some time back. And welcome to all the startups who are presently here and who may be watching a recording of this, later, as it is going to be published through the social media channels of IIT Mandi Catalyst. We started IIT Mandi Catalyst about 7 years back, little over 7 years back. And with the vision of setting up a valley away from valley, we thought all the ingredients that makes a vibrant entrepreneurial ecosystem is available where we are, even though it seems like a remote valley. But there is technical talent, there is a lot of mentorship, technical mentorship. There is access to labs. We had believers in central government and state government through various schemes, the funding that we got. And we felt that the ecology, the place that Command Valley had actually rendered itself very well to be a low-cost destination for very high-quality products that could be developed, deep tech products that could be developed. And 7 years later, here we are with a lot of success under our belt. We have 65 equity-funded startups. We have had exit. We have had so many schemes, and BIRAC. Thank you to BIRAC for believing in us and also coming on board along with so many other schemes that we have always had biotech startups. We've had health tech startups, and we used to send them everywhere else to go get BIRAC funding. We used to say we don't have it, even though we had the necessary infrastructure and the capability at IIT Mandi Catalyst. Somehow, we had not aligned ourselves and got BIRAC into our portfolio as a scheme. So we used to send our startups all over the place, and we were seeing them becoming successful and doing good work. So I'm very glad that we have BIRAC, and we are beginning to bring it all here itself. So I said the vision was valley away from valley, a vibrant ecosystem where we could do deep tech incubation, focus on impact, focus on real stuff that needs to be solved, not just solve for comfort and convenience, but actually access, about improving health outcomes, improving education outcomes, and things which we thought were more relevant for world at large, but also another focus was Himalayan region, either developed for Himalayan region or from Himalayan region. So that became another focus. So deep tech for Himalayan region, from Himalayan region. And the third one is focusing on environment and sustainability and, going after startups that would create impact more than just, yes, money is important, but we didn't want to just focus on money. And we wanted to actually focus on impact. So that's been our vision. It has made us successful so far. It helps us go to bed easily and get up from the bed and come out because we know we are making a difference. We are actually doing stuff that is important, and not just because it's glamorous, but it is important. Solving sometimes dirty problems as well. So with that, I will hand it over to Anand. And welcome you all to be our partner in this journey and support IIT Mandi Catalyst's vision to build a valley away from valley. And thank you so much to Dr. Chaya Chauhan, who's here from BIRAC, who is also behind this whole program that we're doing. And we have our partners in GIMS and AIMS, Bilaspur here as well. So that's really nice to see all of you. So over to you, Anand. Why don't you take it away and then set up the stage?
Thank you very much, Saurabh. So first, I would like to thank the IIT Mandi Catalyst for inviting me and giving me this opportunity. And I would like to welcome all the panel members. So the topic which we are going to discuss today is national importance and how what are the opportunities are there for the healthcare and medtech startups related to preventive healthcare. If you see in India, preventive healthcare sector is expected to reach over $200 million by 2030 with an annual growth rate of 22% every year. So this sector is almost includes fitness, wellness, food supplements, early diagnostics, and health tracking devices, and so much other is also on the way. So when you see the rise of preventive healthcare in India is driven by factors such as increasing prevalence of chronic and non-communicable diseases and the affordability of preventive healthcare. So Indian healthcare startups in the area like nutrition, wellness, cancer, and genomics have attracted investment for more than $150 million. So these startups are leveraging cloud computing, machine learning, and analytics and IoT and so on. So these are the complete areas taking forward the preventive healthcare, and many more are there. So right now, the diverse corporates also playing a more important role in preventive healthcare and partnering with the startups who are coming with new innovative ideas and establishing their own platform also, and delivering the opportunities for the other startups also to collaborate and take it forward. The preventive healthcare ecosystem in India is also being driven by the adaptation of new ages technologies like metaverse and Web 3.0, and startups are incorporating in these technologies to creative, innovative services that also uses gamification, especially in preventive healthcare when it comes to consultancy, when it comes to mental health awareness, and so on. So based on this, you can see how important this preventive healthcare, and we are going to discuss this today with our esteemed panelists. So first, I would like to welcome Dr. Chaya to give an overview of how BIRAC is supporting the healthcare startups and biotech startup, and how the GBI is gonna be support the innovator to outreach and other aspects also. Dr. Chaya,
Yeah. Can you hear me?
yes.
Yeah. Hi, good morning, everyone, and thank you, IIT Mandi team, for having me today. As I mentioned by Anand, so I represent BIRAC. BIRAC is an organization that was set up by Department of Biotechnology in the year 2012 to support startups and entrepreneurs in the biotech domain. So before beginning with this panel discussion, so today we are also meeting for the Global Bio India Roadshow. That is a mega event that is organized by BIRAC along with Department of Biotechnology to showcase our strengths in the biotech and related domains across the globe. So I would first take you through what Global Bio India is and how how all of you can leverage from that event. And then maybe we'll move to the specific discussion. So allow me, 5-6 minutes, and then we can move to the discussion. Yeah. So I have a video which I wanted to play. So can I share my screen?
Yes,
Yes,
please.
you have right.
Yeah, okay, thank you. Let me know if you can see my screen.
Yes, we can
Can,
see it, ma'am.
can
Yeah,
you
we can
hear
see it.
also?
You need to play it, ma'am. You're not able to hear it, ma'am. We can see the
You're
screen, but not able
not
to hear
able
it.
to hear?
Yeah.
All right. Okay, just give me a second. Okay. I don't know why you're not able to hear the audio.
I think you have to reshare along with video. If you can reshare,
Okay.
and there will be option. Yes.
Yes. Can you hear now?
Yes, we can hear you.
We are very enlightened to be a part of this Global Bio India 2023.
Very excited to go in this thrilling event.
This is our first time in India, but also at this fair. We are grateful to Bayrak for this opportunity to invite us.
मुझे लगता है कि अपनी तरह का पहला और इस प्रकार का भारतवर्ष में आयोजित हो रहा है और जिस तरह से नए आयाम बायोटेक्नोलॉजी सेक्टर में हिंदुस्तान तय कर रहा है उसका एक प्रतीक है। और प्रधानमंत्री श्री नरेंद्र मोदी जी ने जब से बहुत सारे इस तरह से रिफॉर्म्स लाए हैं जिससे लिबरलाइज हुआ है हमारा साइंस सेक्टर, चाहे वो अंतरिक्ष का विभाग था चाहे दूसरे विभाग थे, उसके चलते ये परिणाम है कि जहां 2014 से पहले मात्र 50 बायोटेक स्टार्टअप हुआ करते थे देश में, आज उसकी संख्या बढ़कर के 6000 तक हो गई है।
And what we want to build now is the biovision for Bharat actually. That will catalyze our Amritkal journey, that will make us more self-sufficient, reliant, green future and a sustainable models that will actually be completely transformative for this country.
In my plenary sessions, I mentioned about how could we could be joined up with the bioeconomy, and Honorable Prime Minister has dreamt of making the Bio India very much linked to the economy side.
It's a very wonderful event organized by Bayrak, so where we can meet exactly our right customers, the startups and all the incubation facilities across all over India.
Connecting with the R&D diaspora of the country as well as learning and interacting and networking, and also there are a lot of live sessions that are happening.
So this experience has provided me insights on so many things and how to get along with the social innovation and how to actually create a venture out of it.
It feels good to see India innovating at such a huge scale.
Yeah. Hope you could see the video.
Yeah.
Yes.
Yeah. Okay. So this was Global Buy India 2023, where startups, academia, incubators, all of them participated to display what they offer. So industry was also there, so startups could directly connect with the industry. There were incubation centers, I think more than 100 incubation centers participating. So showcasing their startups, their strengths. So all of them related to biotechnology, healthcare, agriculture, all these domains at one place in Delhi. So this year also we are organizing this event in the month of September. And I would urge all of you to participate in this event. And I think Himachal has not, I belong to the state, so it is very dear to my heart. So I would urge all the startups who are from Himachal, they should take advantage of this opportunity and showcase their products, technology in this event. Also, if there are any representatives from state government of Himachal Pradesh, so we would like you to come forward, be the state partner in this event, and demonstrate what Himachal Pradesh offers for biotechnology and agri and healthcare related startups and entrepreneurs. So this is from my side. Now I would also like to take you through 2-3 slides where I would share what BIRAC does and how BIRAC supports the startup and in startup ecosystem in the country. And then I think I'll share the stage back to Anand for further discussions. So this is. Can you see my slides?
Yes.
Yeah. Okay. So this is what, as Minister Dr. Jitendra Singh ji also mentioned, that this is what has been achieved in the past decade in the biotech domain. So we had around less than 700 startups in 2014, and now we are 7,000 plus startups in this domain area. With 6 incubation centers, we have around 95 plus specialized biotech incubation centers in our country. Number of products, from 10 to we've moved to 800 plus. So this is what we've done in the past decade, and all this because a separate entity was created, which was BIRAC, to support startups and entrepreneurs in the domain area of biotechnology. We were created in 2012, and we support startups and entrepreneurs in the healthcare domain, agriculture and allied areas, waste management, sanitation, clean energy, industrial biotechnology. So all those sectors which you can name related to biotechnology, we support startups and entrepreneurs in those domains. And how do we support? So we will provide, just briefly, we provide funding to the startups. That is, we have funding schemes which directly support startups. So they have to apply at whichever stage they are in. They have to apply through our online mechanisms, and then if they are selected, they can avail those fundings. So funding can be in terms of grant and aid or equity also. So we have funding which starts from ideation level to up till commercialization. So we, vendors, even a student or a researcher, if they have an idea, they can, submit their proposals. There are schemes for that level also, and then up till late stage product development or for commercialization also we support. So this will begin from around 15 to 20 lakhs at ideation stage, up till 7 crores for late stage product development. So this is how we support. So in addition to this, we also support for recognition at various national and global platforms. We also provide mentorship. We have an IP and regulatory cell which is dedicated to support startups and entrepreneurs if they have any queries related to regulatory and IP. We also have built this supportive ecosystem through these incubation centers across the country. So we have around 95 plus incubation centers throughout the country, which are housed at various universities, institutes. So even IIT Mandi recently has received the BioNest grant, that is for setting up of an incubation center. So these incubation centers provide, different kind of mechanisms to support startups and entrepreneurs in the biotech domain. So this is also how we support. So these are the various programs. So we also have various international and national partnerships. We also provide support through those partnerships. We have dedicated schemes for each and every stage of startup. So we provide funding support through those programs. We have various mission programs where we support dedicated missions like National Biopharma Mission or Global Challenges. So those kind of supports are also there. So this is the kind of impact that we've been created till now. We have supported more than 800 products that are in the market. We have supported 95 plus incubation centers. We have, provided more than 6,000 crores of investment to, the startups and entrepreneurs, and also to the companies for translational work. And we've supported more than 4,800 startups or beneficiaries, which could be little, medium, or larger companies as well. So these are the our incubation centers that are located in the country. So you can see, these dots. So these are the locations where these centers have been established. And, from 6 centers in 2012, now we are 95 centers plus. So 75 centers are dedicated bio incubation centers. Then we have additional 20 centers, which are our EUA centers, which are pre-incubation centers where we support, smaller incubation facility, but we also provide, fellowships for students and researchers. So that is also there. So this is about what BIRAC does. And as you already, all of you have seen the video. So we are hosting this Global Bio India again, and from 12th to 14th September in Delhi, Pragati Maidan. And I would again take this opportunity to invite you all for participating in this event. Just to take you through, so what the highlights of past year's Global by India. So we had 30 plus countries that participated, more than 500 exhibitors, 5,000 plus delegates, 1,000 plus startups. There are opportunities for media interactions, workshops, boot camps, bio partnering. There are dedicated sessions and policy dialogues. So there are also country and state pavilions, CEO roundtables, and also an opportunity to meet various government enablers from various different agencies. So these are just snapshots of the Global by India. And who should attend? Large industries, small and medium enterprises, startups, and entrepreneurs. Also, as I mentioned, states, those who are promoting investments in the biotech domain, are also, we look forward to host them also. Enterprises looking for business partners and distributors. Investors also, we urge investors also, because all the startups in this domain area would be there. So we invite investors also. And then industry associations, bio incubators, entrepreneurs, researchers in this domain area are invited to participate in this event. So these are the key elements of GBI. So we'll have B2B, B2G, G2G meetings, policy dialogues, CEO roundtables, bio partnering sessions. So all of them at one place. Just to give, I think the audience of today's event is a startup. So just to give you a brief about how to register. So you can go to Global by India website, and there you'll get this registration metrics. For startups, I would mention, so there is a deadline till 15th of August where you'll get some concession, that is early bird discount. And you can register at 7,500 rupees, and you'll get a pass for 2 delegates and a 3 square meter built up space where you can exhibit your product or technology. So, and this includes accommodation also. So accommodation we only provide for startups. So I think you can avail this opportunity until 15th of August, because after that it will get, to 10,000 per booth. Yeah. So this is it from my side. If you have any queries regarding Global by India, there are numbers also which are displayed on the website also, and email IDs also. Other than that, Anilji has my email ID and my phone number. If anybody wants to participate or has any query regarding this event, can directly reach out to me and let me know. Yeah, thank you. Thank you. Over to you, Anand.
Thanks, Dr. Chaya. Thanks for the wonderful video you brought back to the memories from the last year GBI, and looking forward everyone to meet you this year also. So now I would like to ask the next panelist, Dr. Vikrant, about what do you think about the preventive healthcare currently, and how important it is and how crucial it is for the nation?
Yeah, thank you, Anand, and thank all IIT Mandi, BIRAC, for giving me this opportunity to share some of the views on preventive health. Yes, I personally believe that it's an old saying that prevention is better than cure. So with with that line, I think the preventive healthcare has immense potential for startups in this country, because it's like an ocean actually. Whatever Dr. Shaya was mentioning, I think that those all things, most of the people, they are doing at the tertiary care level, secondary care level, but people are forgetting the primary healthcare level in this country. So because that is the basic fabric of healthcare delivery model of this country. So one thing I would like to stress upon, that we should drive a policy that most of the startups should go to the primary healthcare level. Currently we have lakhs of primary health centers, sub centers in our country, where actually healthcare is being provided. So most of the startups should concentrate on the problems and the problem statements in primary healthcare as well as in the tertiary care. Because if we for say diabetes mellitus, if we uh, uh, make some monitoring tool with data analytics, which can give the uh, alerts to the patient or to the doctor at the primary health care center, it will avoid thousands of complications of diabetes, which comes later on in the tertiary care and secondary healthcare levels. So I personally believe that preventive healthcare at the moment is highly required for this country.
Very well
This
said,
is
Dr. Kiran.
yeah.
It's true that for primary healthcare center itself, we have to start at the beginning itself to reach out the down low income population also. That is also more important for us. So it's very well said. In this note, when you come to preventive health, the topmost sector which we are now is on talking, everyone is talking about in mental health. So in this scenario, I would like to ask Dr. Kiran. So can you tell us a brief about how mental health is going to change the world? How the startups which are working on mental health will be? What is the opportunities are there for them?
A very good afternoon, all of you. Thank you for providing me the opportunity. Basically, I'm not, see, if we look towards the two dimensions of life of an individual, one is the mental makeup or the mental health, and another is the somatic or the bodily issues like diabetes, hypertension. I'm not emphasizing that it is important to have a mental health and not a physical health, but I think both of them go hand in hand. And more so, sometimes it is very important, and I think it is most of the time important that both of them are at perfectly state, mental health and the physical health. But mental health in a large society, in an individual, to the large extent, actually increases the burden of the healthcare system. We are not aware. And there is no awareness. And this is a fact which has been stated by National Mental Health Survey 2016, which was an ICMR-based survey. And they have said that there is a problem with the awareness of that there is a mental health issue. Then there is a treatment gap. They have also assessed regarding the system to provide mental opportunities. So there is a lack of awareness in terms of that whether I am mentally ill or not. So that becomes a very important question. And that question has to be, or is in a process in which I'm a part, that am I aware that I am having a mental illness? That is important. So startups should look towards any sort of things, because you have to look forward. We don't have to go that the patient should be mentally ill to that level that they require a tertiary care center. That has to be started from the ground level, from the community. That is important. The second thing which is there with the mental health issues is the stigma. However, if we look towards the last 10, 4 or 5 decades, the stigma which was there initially, maybe 4 decades late, previously, we had found that this type of stigma has been decreasing, but still there is a sort of hesitancy in terms of the community level that there is a problem. So, getting an innovation in terms of biotechnology, which actually, people can use at home, just to primarily assess whether they are suffering from certain illness or not, or maybe they can require certain help or not. So if that thing can be addressed, so it basically sorts out a type of stigma. That means it can answer this. It's not important that they should go, but it will give an awareness to an individual that yes, I require a treatment. So probably a sort of certain things, or maybe certain indicators or some devices where they can understand through certain questions or whatever we have been in a planning sort of, which is very important. And then instigating the people that mental health is much more important as compared. I'm not saying that it is the primary thing, but it is also a fact. So for making that aware through the startups, it will be beneficial. So we can look forward to this, and we are joining hands with certain startups for doing this thing. So
perfect. Thank you, Dr. Kiran. So based on both the questions, the first one and the next to the Kiran, so Dr. Chaya, I would like to address how BIRAC is going to help the new and budding entrepreneurs in reaching out to the community actually. So because both of them said the data is important, based on the data only, the gap can be found, and the new innovator can find a solution. So how BIRAC is supporting them in connecting with the community?
Yeah, so as Anand, you're also aware that out of these 95 incubation centers, I think 7 or 8 centers we've consciously they have been housed in hospitals, hospital settings. So we realize that there's a gap what startups are making, or what startups are working on. Those problems are they are aloof of what the clinicians are expecting, or what actually the consumers require. So we realized that there's a gap, and also they could not test their products and technologies. So we realized this gap, and then we consciously started, seeding these incubation centers at hospitals also. So I think one of our incubation center is housed at Sri Ramchandra Institute of Higher Education, which is a hospital. This is also one of the ways how we are supporting startups, and how we are bridging this gap between clinicians and the startup community also. And these incubation centers serves as a window where the startups can reach out to patient, can access the patient data, can access, can talk to clinicians what the actual problems are, whether at primary level or so. All of these things are being addressed by these incubation centers. It's just a step that has been initial steps, but we believe that it will help in the long run, because many of the very reputed hospitals like AIMS, MSMF foundations, Sri Ramchandra, so they've started they've joined this movement of supporting startups and entrepreneurs. They have given space for these incubation centers at their hospitals, which is a very big step. And so these opportunities are there. So now the startup community also has to come forward, and they have to avail this opportunity. So we've created these facilities, we've created these centers in the hospital settings, where they can get the access. There is access to data, there is access to patients, there is access to samples. So there is access to testing facilities where they can test their products, and before going to into the real world. So all of these opportunities are there. So now the startup community has to come forward, or entrepreneurs have to come forward and begin these things. And plus, we also provide funding also. So not just these facilities are there. There is opportunity to avail funding also by having these ideas. And also, there's one more program which is called Sparsh, which you must be aware of, where we provide there are researchers. We provide opportunities for immersion also. So they can go to those settings, learn, stay with the clinicians, learn for few months, and then come up with a solution for a particular problem. So these such kind of programs are available, and through these mediums, I would urge startups and entrepreneurs to take these opportunities and take their ideas forward.
Perfect. So Biorac has completely done from their side, setting up an hospital in technology part where both can develop their product together in the collaboration way. So it is well said by Dr. Chaya. And when now I'm coming to Dr. Vikrant. So day-to-day life, you are regularly seeing multiple patients coming with new problems. So I would like to take your inputs on how important to develop early stage diagnostic kits for the preventive healthcare, and by reducing the cost of it, how it could be impacting the society.
Yes, it's a very valid question you asked, Anand. I think the it's always important that we should give the impact at the very first stage, because see, in healthcare we have different levels of care. It's a preventive healthcare, primary healthcare, secondary healthcare, and tertiary healthcare. It's a model, actually. It's a model of community healthcare. So if we intervene at the first step, then it will be helpful for reducing the disease outcome, or the severity of the disease will be decreased. Yes, these such technologies, which are point of care investigations, or the development of some biotechnology kits, which can see in corona, if we see how the PCR kits could revolutionize the whole of the treatment, or not say treatment, it's the strategy for counteracting the virus. So I think it's a valid question you ask. Definitely, we need to work on this area, developing some kits, some biotechnology interventions should be there for diagnosing the diseases at the first time. So I just want to add one more thing, which Dr. Shaya has commented. I think for startup, there is we should give that advice that they should go for immersion program first, with some attachment with the hospital, or with some clinician at very first stage. Because most of the time, it's my personal experience that I've seen that most of the time, after building something, people they stuck up where to go now. So see, in healthcare setup, there are many strict regulations, and there are few guidelines one has to follow. One has to follow the ethical guidelines. One has to follow the ICMR biomedical research guidelines, TST guidelines, or something like that. Most of the startups, they come with brilliant ideas, but because they not include the healthcare professionals at the first stage, then they are in doldrum at the later stage. So that is a very, very relevant and very important advice to all the startups, that they should first go with the immersive program, and then they shortlist some of the healthcare professionals from the beginning, so that later challenges they can avoid. So this is my take on that.
Great.
Thank you, Anand.
So very well pointed, Dr. Vikrant. So initially, nowadays, as supported by BIRAC, so already people have started connecting with the clinicians, and they addressing the gaps whichever is there in the society now. So when Dr. Kiran, I would like to know from you. So how important is the evidence-based approaches for the mental health innovations? So how it could help the startups also when it comes to evidence-based approach?
For an evidence-based approach, if we as clinicians in the medical profession in our branch, we have to understand that everything which we are doing is logical in terms that it has a positive output or the positive outcome. We cannot see, if we say that this is a person who is suffering from XYZ illness, and I will treat, it is my take that I want to treat that person with this. So it's not right. We have to understand that whatever treatment we are giving, we have to follow the ethical guidelines. So the ethical guidelines basically says you have to follow what is beneficence, the rule of beneficence, that what is benefiting the patients, and dictum of non-maleficence, that you are not doing any harm. For that, we have to treat the patient according to the evidence-based practice, like what is the result of the various RCTs which are there, or if it is not available, if the multiple RCTs are not there, we have to or maybe then we have to go for a single RCT, or the levels of evidence which is there in the particular field, or maybe the particular illness which is there, or maybe a particular case population, a special population like a geriatric population or a pregnant or a lactating females. It's very important. But what we are looking towards is the in a general population and in a specialized populations, the evidences are different because their physiological system, their mental system, the amount which is, the amount of drug or the efficacy of a drug or the interactions, they have to be channelized as per the evidence. But yes, these evidence are based on the research. So the point is, we should all look forward to doing a very, a research which has a huge amount of data and which has to be, a type of more statistically significant research, because evidence changes as per we do the research. So it's not that we have to be very stringent with see, this is the evidence and I have to do it. We have to take the help of it. We have to take a decision based on it. But then there are certain scenarios in which we can change. But evidence comes when the awareness is there. I will always say this.
It's perfectly right. So more than evidence, the awareness should be there and among the customers. So that is the more important. So based on this, to follow up with the Kiran's answer, I would like to know from Chaya. See, a lot of mental health startup is coming up. The mental health awareness should be more among school kids and the college teenage students. So how BIRAC is going to facilitate? I know BIRAC is providing a lot of opportunities to the startups for the outreach and to acquire the customers in multiple ways. So this, particularly in mental health space, if BIRAC can support the startup to reach the customers in bulk level like schools and colleges, that would be more easy for them to reach, to gain the traction, and even the evidence-based approach also will combine together. So what is your feedback on this?
Yeah. So actually, right now, BIRAC, we don't have this mandate for going to school student level or that. So we come into the picture after, undergraduate or postgraduates. But yes, there might be many startups who are working in these areas, and and mental health is a very crucial topic these days, especially for school students. We do understand this, but I think that is not BIRAC mandate as of now. Yeah, so I would, maybe pass this question.
Thank you very much for the input. So I would like to know from you all, so what are the opportunities for the budding entrepreneurs, especially in the healthcare field? So you can name a few of them based on your experience, based on the innovation space you have already seen. I would like to comment everyone on this. So what do you, Chaya? Would you take?
I think Dr. Vikrant is maybe speaking.
Yeah.
I don't know. We cannot hear.
You're on mute, Dr. Vikrant.
Yes. Yeah, Anand, I feel that it's already started. Wearable technologies, health tracking, monitoring, telehealth, the health improvement, process improvement in healthcare settings. These are the various technologies where people can look into. And one more request is that please please visit your village primary health center first. If we can produce one problem statement from there, which people are facing, it may be people, maybe doctors, maybe healthcare professionals, that will be a wonderful thing to do. Then they can think that how new ideas they can test in the real time settings. So these are the various areas, and new areas are like robotics, in improvement of health, hospital processes, where we are conducting a one program with some innovators like robotic assistant for emergency. So these such ideas could be taken. And another thing is we can go for some robotics, and we can even think on how we can improve the referral systems of this country, because see, we don't have a proper referral systems in the primary to secondary to tertiary care. It creates lot of problems to the patients, as well as it adds to burden to the economics of the hospitals or the healthcare system per se. So these are the few things where people can think, and then they can take it forward.
So Dr. Kiran?
Yeah. I want to say that if we are looking towards the child and adolescent mental health, there are two major issues which are there, which are very significant and has been if we look towards the prevalence which has increased in the last 1 decade, one is the substance use, which we should focus, we should target. And it is another part, which is the sub part of that majority of the diagnosis of substance use. There is the behavioral disorders in terms of gaming and gambling, the online phone uses, or maybe you can say the internet use, which is common over there. So what we are doing is we as a clinician, what we are doing is the creating awareness, but it's not going to create a huge impact. So that is how a science person or the startup should combine with the clinical practice, and they should understand that this is the gray area. If we look towards, there is a huge problem of substance in our country now, and it is actually creating an environment which is not conducive for any working place. So that is a very important. That is where the things should connect. We should connect as the dots. But now, looking towards the another aspect for which the schools are extremely aware is the certain other psychiatric disorders which are there in the child. If you go for that, then the schools have the CBSE curriculum or the ICSE curriculum. They have a very specific mandate for students. If they are lacking in one subject or any of the subjects, or there are certain behavioral issues, it is a mandate from CBSE that they should go for a psychological assessment, which might be because of autism spectrum disorder or the specific learning disorder or mild mental retardation. So it's there. We are having intellectual disability patients. So that is mandate, as we have mandated from the school boards. So that is being done or looked after, and the children or the patients or the people who require that help, it's given. But for substance, it still requires the dots to be connected.
Got it. Dr. Jaya, would you like to comment on this?
Yeah, so there are various fields, as Dr. Vikrant and Dr. Kiran also mentioned. So the current fields are like AI, ML based technologies, or providing access to telemedicine and consultations. So although all these are kind of opportunities for startups to come in, but then there are so these are like low hanging fruits, but then there are deep tech also, high technology related startups also working in drug discovery or those kind of things also. So BIREC supports all kind of startups in these domain areas, and we, as I've already mentioned, healthcare is our prime focus. So more than 60 to 70% of the startups that we've supported are in this domain area. We are committed to support research, translational research, and students, researchers, to entrepreneurs, startups, even companies for undertaking R&D in this domain area. And for the same, we are committed to support this field And we have set up incubation centers in hospitals, and we will continue to support more hospitals which have come forward for such initiatives. And I was also looking through the chat, yeah, so many people have asked how to get access to data and all. So, I would recommend that Anand is also here from one of our incubation centers. He will be able to guide you all through for this also. So now I don't think that location matters, because be it Chennai or Himachal, or so, since all of us are connected virtually, so getting access to data, or first guidance also, that how to go about things, this can happen. So all of us are sitting in different locations and talking. So now I think we should not wait, that wait to seek opportunities, because opportunities are already there. So we have to come out of our comfort zone, call people, ask people how to go about it, because there are so many people who are ready to help. So yeah, so that is my take on this, that come out of your comfort zone. There are several government agencies ready to support, ready to fund. There are investors who are ready to fund, and then there are incubation centers where there are all kind of facilities who are ready to facilitate whatever help you require. So I think this is the time when people should come forward and take advantage of it. Yeah, over to you.
So to follow up with Dr. Chaya, I would like to tell that SRIC here we are planning for not planning, we are actually started for a data biorepository, and initially we started with cardiology samples data. Now we are looking forward to move for other specialization also. So this is one key point and key takeaway I would like to share it with the startups. And Dr. Vikrant, so as you said, the new technology will be helping for the preventive healthcare. So when it comes to new technology, what are the general challenges are faced by the startups when it comes to completely new innovations, and how they can overcome it? You are on mute, Dr. Vikrant.
Yeah.
Yeah.
I was about to intervene for this discussion actually, because see, a budding startup innovator, he has some idea, but he don't know the nitty-gritty of the legal aspects of prevalent legal laws or the rules, guidelines of this country. So I believe that regulatory framework is the first challenge people are facing actually. So regulatory framework specifically, most of the people, when they start, they are not aware of the ICMR guidelines of biomedical research. They are not aware of some data privacy acts or something like that. So giving some immersive teaching in these aspects specifically for biotech innovations is essential. Wherever I went, I always said to people that please take care of this aspect first. Then only the things will roll out. Then if we say there are Drug and Cosmetic Act, people start developing something new, but after some time they got a hurdle that this is not feasible because it has not been approved by some ethical committee. Even at AIMS, on the daily basis, I get 2-3 proposals, but unfortunately, people don't have ethical clearance for that, doing some validation or for clinical trials of that thing. So I think this is the biggest hurdle in biomedical or biotech or medtech startups. They must give some training or some immersive trainings for these aspects. And as Dr. Shaya mentioned, that there are programs. First program is there. I think that should be expanded to nationwide, or there must be some 2-3 days or 2-3 sessions on this aspect of the thing. So this is the biggest challenge. Second challenge is as you have just mentioned that you are going to start a cardiology repository and all that. People don't get the baseline data for doing further research in AI or ML. What is baseline data? Like authentic data. I think authentic data source they don't get. Or see, in healthcare, every disease is very specific to some of the region or some of the environment. If we implement the international prevalences or international things on our population, it will be difficult to find out the answer for that problem. So I believe that our authentic data should be there in the form of repositories, so that we can give access to the people who want to do research in such areas. Recently, I was doing some ML research. We were not able to find images of that particular disease in Indian context. Although the innovation was for Indian population, so we get data from some online repository, which was got invalid at a later stage. So it adds to our frustration. What is going on in this country? So I believe we can concentrate on these few things, which is actually required for improving the preventive healthcare startup ecosystem of this country. So this is my take on. So basic point is we should concentrate on we should educate or aware the budding startup innovators for regulatory framework of this country, which is always lacking at a later stage. Thank you.
Thanks for your wonderful, valuable discussion, Dr. Vikrant. So Dr. Kiran, I would like to take upon, when come to preventive healthcare, so there is a separate space for food and nutrition and food supplements. So I would like to know from you about how this food related supplements, related startups will be helpful in taking forward the innovation spaces in the preventive healthcare segment.
Basically, for a healthy mind resides in a healthy body, and healthy body is basically because of whatever we are doing in terms of nutritive value of the elements which we are having, and the daily routine exercise, the lifestyle habits. So both of them play an important role. So there has been a major issue in India of a shift of a pyramid from a infectious to a non-infectious or the chronic illnesses, in which the obesity, cardiovascular diseases, they have created a huge lot of ruckus, and it's a major headache. If you look towards, there is an epidemic of diabetes. So there are so many, if you look towards all the disorders in terms of diabetes, hypertension, or maybe cardiovascular diseases or the renal diseases, they have their own starting. If we look towards, if we take an example of diabetes mellitus, an average duration in which it is discovered is after 5 years you have an illness. Like if I am having diabetes right now, probably it will take 5 years to get me diagnosed to have a diabetes of type 2 status. So now what we can do is, but this diabetes is not 100% preventable. There are certain where there is a genetic factors. If we leave aside that, approximately 80 to 90% of the diabetes can be controlled at a preventive state, and for which the nutrition is very important. So whatever we are eating, what is the important elements which have to be there, and in what amount, that is very important for any particular illness. So what we do is we are eating a huge amount of junk food, and then we are actually moving towards an epidemic of non-communicable or maybe these chronic illnesses. So the nutrition at the day one, when we eat healthy, and we have a dietary modifications as well as the lifestyle modification, not only the nutrition. Of course, nutrition plays an important role, but both of them should be handled together so that the person have a healthy life. We have improves the quality of life. So there we can actually put forward, like if renal stones. So, there is a certain population which have oxalate, high amount of calcium, high amount of this contents in their diet. So if we regulate them, we don't have an illness. So it can be started at a nascent stage. So, we don't see the worst part of it.
Thank you, Dr. Kiran. So based on all this, I would like to comment a few things. So actually the foundation pillars for the startups who are especially working on preventive healthcare in India, basically the three A's, whatever the esteemed panel member have discussed, it should be awareness is must and accessibility, and third one is affordability. So if you see in the, as per the government Ayushman Bharat Digital Mission, in the implementation of um, for the further strength and availability of data and its utilization, I think BIRAC is doing it and implementing it very well based on the ecosystem which they have built right now with various incubation centers and star corporates, and bringing the foreign investors and Indian investors to give a good health in the nations. So with this, I would thank all the panel members for your valuable input in this preventive healthcare space. And yes, please. Yes, Dr. Vikrant.
Yeah, I have penned down some of the carry-on messages.
Sure, please.
I just want to share that. The first thing is go to last mile for exploration to the PHCs, sub-centers for idea generation. That is must for preventive healthcare. Second is include medical professionals from day one. If you are not putting him or her as co-founder, take him or her as a mentor. That will be a better option. Third is the regulatory framework of healthcare ecosystem. Must learn, no excuse in that. Fourth one is AI and ML and robotics could be a game changer, or it may do wonders if used judiciously on the reliable data source. These are the four take-home messages I would like to give to all the budding startups. Thank you so
much. Thank you, Dr. Vikrant. Dr. Chaya, do you have a take-home message or saying a couple of words for the upcoming entrepreneurs?
Yeah, I think Dr. Vikrant has summarized it very nicely. So, there is, so regarding the regulatory challenges, I wanted to highlight that BIRAC has recently launched a regulatory advocacy and regulatory affairs and policy advocacy cell. The role of this cell is, to help startups and entrepreneurs to navigate through these regulatory hurdles in the biotech domain, healthcare, agri, and related areas. So kindly use this facilitation cell. Then we also have one important point, which I think we forgot, is the IP related issues. So for that also we have a dedicated cell in BIRAC. So all startups and entrepreneurs can, take advantage of that cell also in filing of IP or any other related issue regarding IPs. And then then I think Dr. Vikrant has covered all. Then another very important point is clinical validation. For clinical validation, we've set up clinical networks also through our National Biopharma Mission. And then we have our incubation centers in various hospitals where you can get your products clinically validated and take advantage and help of these incubation centers. We have at AIIMS Delhi, we have in Sri Ramchandra in Chennai, we have in Bangalore, MSMF Bangalore, we have at Manipal. And then, there are some other centers also which are associated with hospitals. So you can take advantage of those. All related information is provided on BIRAC's website. Kindly go through it and take advantage. If in case you require specific connects with the hospitals, then you can write to me and I can also, connect with these hospitals. So that is from my side. Funding and investments, all of you know that BIRAC provides, so that is there. Thank you.
Thank you, Dr. Chaya. Dr. Kiran, you would like to say something?
I
take-home message or?
I like to conclude the government is taking a strong initiative regarding awareness, the availability or the accessibility. It's just that we have to just gear it up through the guidelines, and the evidence have to be generated for the Indian population through the Indian population. So we have to be a bit proactive. We are already doing it. We have to be a bit proactive in doing an evidence-based research where the data has to be generalized for the Indian population as per their nutrition, body build, the mental state, the various myths which are around the world. For any mental illness, there is a different kind of scenario for here in India and in West. So we have to look for our people in an evidence-based practice.
That's nice. So as a total entire ecosystem from government side, from incubation side, from clinician side, so we all working on it to foster the innovation in the healthcare. So once again, I would like to thank all the panelists and IIT Mandi Catalyst for organizing this wonderful talk. And over to you, Dr. Sharab and IIT Catalyst team.
Thank you, Anand, and what an enlightening session. I don't think we were anticipating we'll get a 360-degree view of health tech, biotech when we embarked on this conversation. So very, very pertinent points all of you made. Thank you, Dr. Chhaya. Thank you, Dr. Vikrant and Dr. Kiran and Anand. Wonderful moderating the session. I think I wish more and more entrepreneurs were attempting startups at this point in time. What you're doing in terms of mentorship, providing the scaffolding to build a successful startup is incredible. I've always been impressed by BIRAC's dedicated effort, consistent dedicated effort towards building startups. The generous grants and the amount of mentorship that is available is quite incredible. And I'm just it's music to my ears to hear Dr. Chhaya talk about the IP, regulatory, policy advocacy, and clinical trials, infrastructure, and the support that you're providing to startups. I'm sure that we will actually use all of these and build some really, really credible startups, going forward. So thank you once again, and we hope that we will continue to engage with all of you and join forces to build these startups that we have to build to change the face of healthcare and medtech landscape in India. Thank you so much.
Thank you very much. I wish to see you, hoping to see you all in GBI soon.
Yes,
meet you all.
Absolutely. Thank you.
Thank you. Thank you.
Thank you. Thank you so much.
Thank you.
Thank you.
Much.
Bye.
Thank you so much for joining in, guys.
Thank you.
Thank you so much.
Thank you.